to see an impact. And I can tell you the focus right now is the integrated mobile health teams now are scaling up across the county. So in Los Angeles County is divided into what are called service planning areas, SPAs. There are 8 of them in the county. We happen to be in SPA 5 here. But that goes all the way from Antelope Valley, Lancaster, Palmdale, the north, to Long Beach in the south. All of these SPAs, there are currently 26 of these integrated mobile health teams, and there will be 36 by the end of the year. What that will do is provide every community with ongoing access to very similar work that you've had the privilege of having here in the Palisades. So that's very exciting. Then there will be additional resources put into mental health care, medical care, and then wraparound services in permanent supportive housing. So it's an exciting time for us. It's going to take a minute. There's a lot of, bless you, there's a lot of pent-up excitement about H and HHH, and I just want to kind of temper expectations a little bit in that we are at a moment in time where I think we have the opportunity to do something really historic and strategic, but we also have to realize that we are working in a very expensive and tight real estate market, and that is not going to change. All of the resources in the world are not going to change market forces. So we have to be aware that we can't just snap our fingers and press a button and suddenly homeless people are going to be moving off the streets into permanent housing overnight. So I wanted to put that out there because I get asked a lot. I was just in Sacramento this weekend doing a presentation for the California Association of Planners, and it's interesting because people from other parts of the state have heard about Measure H, and so everyone is saying, well, the next time I come to Los Angeles, I'm not going to see, you're going to build all this housing, right? And well, yes, but it's not going to happen overnight. And I wanted to say, you guys are urban planners. You know how long it takes the government to do anything. So, but it is actually good news, and it will be an opportunity for us. So with that, I'm going to stop, and now it's your turn to ask questions. Yes.
John, thank you so much for your presentation. You told me to ask questions.
Yes, I did. I did.
You did.
I invite you to ask questions.
I've worked in OPCC for years. Do you still have all those arms, like you have Daybreak?
Yes.
Would you name them off, all the different?
Sure. Okay. Is this a test to see if I can name all of our programs?
Thank you. That's for you. Thank you again.
So all of our programs, thank you for your support. So yes, so many people know our agency by our programs. So you may know Turning Point or Daybreak or Sojourn or Turning Point or the Access Center. Those are kind of our core programs. They've expanded Campion, which is our mental health program at one time, which is now decentralized, so it's not a standalone. So those are, yes, all of those programs still exist, but they exist in an integrated fashion. So there is a lot of fluidity within our organization. We really take a no wrong door approach. So for instance, Sojourn, our domestic violence program, operates a 24-hour hotline. It's staffed by, whenever I say this, I always think it sounds odd. It's staffed by a live person, as if a dead person would be answering that hotline. But it is not a machine. You actually get a staff member or a trained volunteer 24/7, 365. And so often we get calls on the hotline where a woman will present as being a battered woman. In fact, she is a battered woman. And then we begin to work with her and we find out she may or may not be homeless. She may not be struggling with mental illness or addiction. Someone may come to the Access Center, the County Access Center, and say, I want a shower and I want to use the laundry facility. And we begin to work with them and we find out that there are other things going on. So the point in that is we kind of see our services and all our programs like spokes on the wheel, or doors, through which we're a permeable membrane for you biologists in the crowd, that there's no wrong way to access services. And because these issues that our clients are dealing with are so intertwined, it's not unusual for us as we kind of work with people, and it's like peeling an onion, you peel back the layers and you begin to really understand what's going on with people. Thank you.
Well, recently there's been a hepatitis A outbreak in San Diego, and I want to know if there's a protocol or plan in place, because we don't want that to happen here.
Right.
But have you...
Well, it has already, unfortunately. There's no, so in a much smaller level in downtown Los Angeles, actually, there has been an outbreak of hepatitis A. So for those of you that are familiar or not familiar with hepatitis A, it's basically transmitted usually through fecal matter or contaminated, and so this is common in the food service industry when people don't wash their hands and then touch food and gets ingested. Fortunately, it's treatable. I mean, it's nasty because nobody wants to get jaundiced or anything like that. There are vaccines that are available. The county, I have to say, the LA County Department of Public Health has done a really good job in getting the word out. I know in our organization, we've had many clinics available where we're providing free vaccinations to our clients and to our staff. Some people are already immune. They may have been vaccinated and don't even know it. In downtown LA, the outbreak happened in Skid Row, and of course, because we have facilities down there, this is particularly an issue of concern for us, because if any of you have spent any time in downtown Los Angeles, you know, the streets are really breeding grounds for bacteria and things that are not healthy for humans and other living things. So the good news is that the information is out there. There's been a lot of information that's disseminated. People have access to vaccination. So I don't think we're going to see a large-scale outbreak. That's my prediction, yeah, which is a good thing.
Okay, I have a family member who's struggling, who's homeless, okay, and that's part of my motivation of coming also. So I want to know about access, because you didn't give like locations. How can I pass that information on?
Where is your
Well, we're in the
person?
street Palisades.
Right.
This person, we never know where she is.
Okay, is she in or around the west side?
Yes.
Okay.
Probably.
So there are a couple ways. I mean, certainly, if you know where, is it she?
It's a she.
She, okay. If you know where she is, Glenda and Maureen are back here, and so they can give you their contact information. They're happy to try and make contact with the person if she's out and about. We can also alert, I don't know what her patterns are in terms of traveling.
We're paying for a phone, so
Okay.
it can be reached
Okay.
by a phone.
But I'm just saying, if she happens to go to Malibu, we have a team out there as well. And then on the south side, Santa Monica. So the access center that I referenced up here is located at 5th and Colorado. And do we have contact cards for the access center? Oh, Melinda Soderberg has. So she can give you some contact cards, and you're welcome to distribute that card as well.
All right, thank you.
Okay, you're welcome. I hope we can help. Yes, ma'am.
Hi, I'm Lori. I'm from Santa Monica. Tremendous work, the Citizens Commission here. And what do you say to other cities that want to duplicate? It's all about duplication.
Yep.
And I know Thursday they're going to have a meeting with SBA Drive. And what do you say to other cities that are wanting to duplicate, or how do you deal with that?
Well, I'm a big advocate for replication and scalability. I mean, if we want to get ahead of this problem, if every community was doing what the Palisades is doing and what Santa Monica has been doing, you know, it's interesting. I mean, you're a resident of Santa Monica, and I've had the privilege of working there for many years. So Santa Monica gets slapped around a lot, right? There used to be an NPR show that would say Santa Monica, home of the homeless, and you know, there was this ha ha ha. But the fact is if you look at per capita, Santa Monica has done more than any of the other there are 88 cities in the county of Los Angeles. Look at the results that are happening. You don't have to take my word for it. The data supports the fact that this notion that you do nothing and the problem goes away, the reason we're in the mess we're in today is basically 40 years of people looking at the other society looking the other way. If we had been doing comprehensive wraparound services decades ago, if we had not gone down the path of deinstitutionalizing people where there used to be community supports, we wouldn't be in the situation that we're in. So what I say to communities is, get on the bandwagon. You know, if you don't, the very sad thing about homelessness is that it's not isolated. When it was in Skid Row and it was primarily black and brown people, it was over there. It was sort of them. Or when it was in Santa Monica or South LA, or when there are isolated pockets, and I'm speaking in broad generalization, so please understand these comments are not directed to anybody in this room, because you would not be here tonight if you do not care about this issue. But as a society, we have been very comfortable with the notion of the other. And so it's sort of their problem. But now we see in Los Angeles, it's our problem, right? You cannot go anywhere in this county, suburbia, and you see large numbers of homeless people. And so I think that in a perverse way was the springboard for the voters passing HHH and H. And I think that is actually a really good thing, because I think there's been a recognition that we have a shared responsibility in all of this. And so what I say to communities is, if you duck your head in the sand and do nothing, the problem is going to get worse, because it's not going to go away. And our colleagues in law enforcement will tell you, you can't arrest your way out of it. You can't. You simply can't. You need enforcement. That needs to be part of the strategy. But you can't just arrest everybody. And you can't just sweep them from one place to another, because they come back and they don't have a place to go.
Is she asking how to go about it?
She lives in Santa Monica, so she knows how to go there. But that's what I would say, and there are models. I mean, you have the Palisades, you have Malibu, you have Santa Monica. I mean, the best practices that have become industry standards were incubated in the west side of Los Angeles. And I'll brag a little bit and say most of them came out of our organization.
Let me ask you something about homeless people that don't have health care and they get patient dumped. And you don't talk about recuperative care centers, you know, because a lot of cities don't have the budget, they say, and it's LA County's problem. So we're leaf blowing, again, homeless people to other cities, which we're not supposed, you know, which we're trying to prevent. So what do you say about recuperative care centers?
Well, we're a big fan. We actually operate 2 recuperative care centers in our portfolio, and it's a personal passion of mine, in an area that I've done a lot of work in over the last 10 years, working with our hospital partners, because I really believe that the next shift in service delivery is looking at high utilizers of the healthcare system, primarily hospitals, because what you see happening is you see homeless people. The good news about the Affordable Care Act is expanded access to care for a lot of people, but now what's happened is our hospitals have become de facto emergency rooms and primary care centers, which they were never designed to be. And for homeless people, they end up being the place of default, because by law, hospitals have to treat anybody who comes into their ERs and medically stabilize them. It's not the hospital's fault that they aren't equipped to deal with the long-term primary care and the housing needs of these individuals. So recuperative care, and the County of Los Angeles has doubled down. One of the things that Measure H will do is significantly expand recuperative care. The County of Los Angeles got very smart about 4 years ago, under the leadership of Dr. Katz, who realized that because the county is the largest provider of healthcare services to low-income people, and particularly homeless people, that homeless people are recycling in and out of the ERs. They get them medically stabilized, they discharge them, and within a couple days or a couple weeks, they're right back in the ER, and they're just burning up huge resources. It's far less expensive to put them in recuperative care with wraparound services. They get permanently housed. The only time they're going to the hospital is when they really need that level of intervention. So it's a smart investment. It's absolutely the right way to use our resources, and it would drive down costs. Yes?
Could you speak a little bit about the veterans that are on the street?
Sure.
I think I'm acutely aware of the watching the PBS series on Vietnam.
Right.
It's just it's on my heart in the last couple of weeks, the number of people. I mean, that's what it's come to in terms of the trauma that people experience then. So what's going on with the VA property? Is that a possibility for more housing? Is that stuff in the works?
Yeah.
Can
Yeah, so the question is what's going on with the VA property and veterans in general. So let me just say that sort of the bright spot in homelessness for a while was the precipitous drop in homelessness that we saw in Los Angeles County over several years was actually in the veteran population. And the reason is the VA targeted resources, housing vouchers, and supportive services to that population. And so we saw a very precipitous drop in the number of homeless veterans, which is actually very good news. It's starting to go up again. I want to kind of digress a little bit. One of the reasons that we have so many, so I'll just use our agency as an example. So I've been at the agency 18 years. Pretty consistently, out of our total homeless population, veterans represent about 10 to 13% of the people that we serve in a given year. However, among chronically homeless people, those people who've been on the streets the longest and the most disabled, veterans represent about 26%. So they're disproportionately represented in the chronic homeless population. Why is that? A lot of it is the legacy, unfortunately, of the Vietnam War. Many of those veterans they came back from the war. We did to them basically what we did to people with mental illness in the 70s and 80s, as we said, thanks a lot for your service, and by the way, you're on your own. And not surprisingly, 30 years later, we find that many of those folks, because they have had post-traumatic stress disorder that's not been addressed, they've often become substance addicted, whatever illnesses they had become exacerbated by living on the streets. We didn't provide the safety net. To the government's credit, in the wars in Iraq and Afghanistan, not that it's perfect, we certainly have plenty of people coming back with PTSD, but we do not see wide-scale homelessness emerging among Iraq and Afghani veterans the way we did with Vietnam veterans. So while the horrors of war will be with us for decades, the way that we house and treat our veterans is better. Not perfect by any means, but I'm speaking in broad generalizations. In terms of the VA property in West LA, that actually is moving. It's been a very, very long time. I can tell you, we've worked with the VA, and we work with a lot of bureaucracies. They are the toughest. They are really typical. They're very slow. They're very set in their ways. They have a difficult struggle working with community partners and kind of understanding. And I'll just share a very quick anecdote. So about 5 years ago, I was invited to the West LA VA, and I was meeting with the head of that time, the VA, and a Secretary Shinseki at that time, and the head of psychiatry at the VA. And we were sitting and talking, and so they were saying, we're really frustrated because we have the largest medical facility, in the country, VA medical facility right here. We can't get these veterans to come in. We just can't get them to come in. And so I said, well, the challenge is that you have to reform the way you're doing your work, and it has to be street-based engagement. You have to go out to them because they're not going to come in. And he got indignant and he said, young man, I should have been happy that because nobody ever called me. He said, young man, he said, I am a Harvard-educated psychiatrist. I don't do street medicine. And I said, well, doctor, that's your problem. So, and that's a true story, honestly. So, I mean, that's, and certainly the VA, there are lots of wonderful people working in the VA, but there is a mindset there that, again, we have this great institution, we have all these services, build it and they will come. When you're dealing with a population that has already been traumatized, has not been treated well, doesn't feel like they have access, you have to shift the paradigm. You have to take it to the streets.
First of all, I want to thank you for all the great work that you're doing, and your team, and Glenda and her team, thank you so much. I wanted to ask you, since you mentioned that there's a shortage in housing and that your goal is to build a lot of housing, in the meantime, what about all the people living in their cars? And also, can they be protected? What I mean is that can they have more space to park that car in the meantime, because that is their home, that is their shelter. And sometimes they even have a pet in there that they're taking good care of, and they don't have. They're up to date on their registration, they're up to date on their license, but they've fallen on hard times.
So vehicular camping is a huge issue, and you touched on something that is, it's a real sensitive issue, I know, with neighbors and in neighborhoods, especially on the west side, but it's not unique to the west side. I will tell you, to your point, people are using vehicles and RVs as alternatives to inexpensive housing. And the challenge, I think, the push and pull, so there are some opportunities for safe parking. There are some faith communities. Leo Beck Temple is one that started one of the first safe parking, so they have a limited number of spaces on the temple grounds where they will allow people with vehicles to actually camp and park overnight. And it's really a way to provide an alternative for these vehicles not to get ticketed or towed or impounded, which just kind of contributes to the downward spiral for people. The other side of it, sort of the negative side of it, is that what do you do about trash, about dumping waste? When you get multiple vehicles, and they often turn into encampments, and this is one of the biggest challenges where they're lined up. And that really creates, I think, challenges for the neighborhood. And it's not an easy answer. It isn't so simple. For people who are able to move the vehicles, and who are not dumping waste and trash and are just kind of going about their business and finding a quiet place to park at night and not bothering anybody, I think it's less of